Ladies and gentlemen, I am Hunfat. Cigarettes aren't good for us. That's hardly news. We've known about the dangers of smoking for decades. But how exactly do cigarettes harm us? Let's look at what happens as the ingredients make their way into our bodies and how we benefit physically when we finally give up smoking. With each inhalation, smoke brings its more than 5,000 chemical substances into contact with the body's tissues. From the start, tar, a black, resinous material, begins to coat the teeth and gums, damaging tooth enamel and eventually causing decay. Over time, smoke also damages the nerve endings in the nose, causing loss of smell in the airways and lungs. Smoke increases the likelihood of infections as well as chronic diseases such as bronchitis and emphysema. It does this by damaging the cilia, tiny hair-like structures whose job it is to keep the airways clean. It then fills the alveoli, tiny air sacs that enable the exchange of oxygen and carbon dioxide between the lungs and blood. A toxic gas called carbon monoxide crosses that membrane into the blood, binding to hemoglobin and displacing oxygen it would usually have transported around the body. That's one of the reasons why smoking causes shortness of breath and oxygen deprivation. Within about 10 seconds, the bloodstream carries a stimulant called nicotine to the brain, triggering the release of dopamine and other neurotransmitters, including endorphins, that create the pleasurable sensations, which make smoking highly addictive. Nicotine and other chemicals from the cigarette simultaneously cause constrictions of blood vessels and damage the delicate endothelial lining, restricting blood flow. These vascular effects lead to thickening of blood vessel walls and enhance blood platelet stickiness, increasing the likelihood that clots will form and trigger heart attacks and strokes. Many of the chemicals in cigarettes also cause dangerous mutations in the body's DNA, which make cancers form. Additionally, ingredients such as arsenic and nickel disrupt the process of DNA repair, thus compromising the body's ability to fight many cancers. And it's not just lung cancer. Smoking also causes cancer in multiple tissues and organs, as well as damaged eyesight and weakened bones. It makes it hard for women to get pregnant, and in men, it can cause erectile dysfunction. But for those who quit smoking, there's a huge positive upside with almost immediate and long-lasting physical benefits. Just 20 minutes after a smoker's final cigarette, their blood pressure and heart rate began to return to normal. After 12 hours, carbon monoxide levels began to stabilize, increasing the blood's oxygen carrying capacity. One day after ceasing, heart attack risks began to decrease as blood pressure and heart rate normalized. After 2 days, the nerve endings responsible for taste and smell began to recover. Lungs become healthier after about 1 month, with less coughing and shortness of breath. The delicate, tiny hair-like cilia began recovering within weeks and are restored after 9 months, increasing resistance to infections. By the 1 year anniversary, heart disease risk plummets to half as blood vessel function improves. 5 years in, the chance of a clot forming dramatically declines, and the risk of stroke continues to reduce. After 10 years, the risk of developing fatal lung cancer reduces by 50%, probably because of the body's ability to repair DNA is once again restored. 15 years in, the chance of developing coronary heart disease is essentially the same as that of a non-smoker. There's no point pretending this is all easy to achieve, but quitting is getting easier thanks to a growing arsenal of tools such as nicotine replacement therapy. And this is good news because quitting smoking leads you and your body on the path back to health. Thank you.